12 minutes now after the 9 o'clock hour. With the COVID-19 vaccine comes side effects for some people, and with thousands of people contracting COVID-19 each day and with the new variants that are popping up, we want to know, how can you tell the difference between COVID or side effects to a coronavirus shot? Joining us now with more is Dr. Jason Littleton. It is good to see you this morning. How are you?
I'm doing great. How are you, Danielle?
I'm doing good, thank you. You know, I went to get my son his first COVID shot. He's a teenager, but he barely made the cutoff, so we were able to get him a shot. We were talking to one of the workers there, Dr. J, who said he got coronavirus, but now he's concerned as to whether or not he can get a shot and get a vaccine now that he's had COVID. Can you?
You can, but I think it's important to wait till the symptoms go away so that you're not confused on what's at play here. You know, first of all, at first look, vaccine symptoms as far as side reactions, allergies, and COVID-19 symptoms can be very similar, but there are a couple things that actually distinguish them. When we talk about the vaccine, we're usually seeing side effects or reactions within a period of immediately right after the shot to about 24 to 36 hours after. And some of those side effects can be site injection redness, lethargy, fatigue, headache. But when we talk about COVID-19 symptoms, what's important is that these people feel very tired. They have respiratory symptoms such as cough, runny nose. They even have other constitutional symptoms such as nausea, vomiting, even diarrhea. So people who have COVID-19 have a spectrum of symptoms from not being very sick to being severely sick and having various symptoms that are very present and alert.
And so if someone does get the vaccine, for example, but think they may have been exposed, should they then get tested?
Definitely. You know, if you think that you're exposed, what I've always told my patients to do is to let me know so that we can arrange testing. That's very, very important. You want to make sure that if that's the case, that you do self-isolate and that you do let your healthcare provider know. And if there's confusion about that, run it by your primary care doctor.
Dr. J, can we talk a little bit about the side effects? Because one of the things that I've heard from a lot of people, I've had my first shot, I have not had my second shot yet. I'm getting that in a couple of weeks. And I've heard from so many people, and I think you may have mentioned it as well, that sometimes the second shot, that can be the worst in terms of some of the side effects that we can experience. Is there any way to determine who's going to experience what side effects, and what would be the best course of action in terms of what you can experience and what can people expect on this second shot?
Well, you know, with that second shot with the Moderna and Pfizer, the immune system's primed. So a lot of times people do experience greater symptoms on that second shot. Now, if you received the first shot and you had mild symptoms, there's a chance that you may still have mild symptoms on that second shot. But if you had very prominent symptoms on that first shot, you know, you might want to prepare yourself, because that second shot, your immune system is now on red alert, ready to defend itself against COVID-19. So when it gets that second dose, your symptoms may actually be a little bit more moderate to severe.
That is good to know. So if you had kind of not great experiences in the first shot, you're more likely to experience maybe greater symptoms in the second shot. So you always bring the good information. You made me feel better about that second shot. Dr. Jason Littleton, thanks so much for joining us this morning.
Thank you so much for having me.
I appreciate you as always. It is 9:16. Jamie, good morning.